And well, you may not think it can happen to you, but it can, and you may not know what to look out for. Mercy Health Doctor Eugene Lin and registered nurse Julie Goins-Whitmore are with us so we could talk a little bit more about stroke. Thanks for being here today.
Thanks for having us.
This is Stroke Awareness Month, yeah?
Yes, for sure.
So first of all, let's talk about what stroke is, first of all.
Yes. So for us, many of us see and recognize stroke based on the symptoms that we see, and there's two types of causes for them. The vast majority, 85%, are ischemic strokes. That's where there's a loss of blood flow, and it's a blockage of an artery. And then there's another 15% where it's the bleed, where it's a blood vessel that ruptures from high blood pressure, or maybe from an aneurysm. And so those are the two main types of strokes, and then they cause the deficits that are important to recognize.
Yeah, let's talk a little bit about that. Some of those symptoms that we should be, what happens? I think your face might droop or things like that.
Yeah, we use the acronym BEFAST. So B is for balance. So somebody is suddenly off balance, they walk like a drunken sailor, or they are very, very dizzy. E is for eyes. Double vision, blurred vision, maybe areas of blindness in the visual field. And then we go down to the more common FAST. F is for face, so we're looking for facial drooping. Maybe somebody's drooling and they don't normally drool. A for arms, so we're looking for drifting of one of the arms. Okay. So the strength is not equal. Moving down to S, it's for speech. So they maybe are saying the same word over and over, or slurred speech, or they can't find their words appropriately. And that T is for time to call 911. We want somebody to call for help as soon as they notice the symptoms. We find that a lot of people don't seek help immediately because maybe they think the symptoms aren't that severe, or it's really hopefully not a stroke, and we won't keep you in the hospital if you don't need to stay. Sure. So call.
It's important to go then, because
Absolutely.
time is of the essence here, because every second, you were telling me earlier, how many blood vessels are we losing here?
So brain cells, so it's like 1.9 million neurons. So,
wow.
And for us, there are time limits to our treatment. So for ischemic strokes, we have to make sure we can dissolve the clot, and there's a 4.5-hour time limit from when the symptoms start. So to be able to safely give that medication, and even up to 24 hours when we're removing the clots physically, called a mechanical thrombectomy. So the faster we get the patient to the hospital to recognize whether it's an ischemic stroke or hemorrhagic, the better we can apply the appropriate treatments.
Yeah, so just you're not feeling right or you're seeing something. Hey, let's talk a little bit too about maybe other family members or friends who may need to be aware, because we'll talk about risk factors in a moment, but if you know somebody in a loved one who has risk factors maybe for stroke, then we all need to be aware of these symptoms, yeah?
Absolutely. Recognition is key. It's so simple. The BEFAST is easy. Anybody can do it. You don't need special equipment. It doesn't cost you anything. You can't forget it at home. It can't run out of battery. It's all you. It's easy. We have children that can recognize stroke. And we've had cases where family members have been identified as having a stroke by a child. It's that easy.
It's that easy. So, and you can really, again, because time is so important, just make sure everybody is on the same page and has that knowledge. So let's talk about some of those risk factors though, because there are some things that we may be able to prevent and maybe not so much.
Yep, and so there are genetic risk factors. Those are the factors we're born with, but there are many things that we do day to day that we can treat. And once you recognize that there's high blood pressure, you can make sure you take the medications, or tell the doctor if those medications don't make you feel right, we can find the right ones that work for you. There's high cholesterol or hyperlipidemia. Statins are very good to reduce those. There's diabetes, making sure you have good control, watching what you eat, being on the right medications. Obesity, making sure you control that weight loss, making sure you obtain the results that you want, watching what you eat, exercising, and smoking. That's one of the major factors where if you have the right support, you can try to cut back on that smoking, and that will tremendously reduce the chance for the next stroke.
Wow, so some things we can do, to prevent this. We were also chatting earlier, just because we're young, that doesn't necessarily mean we might be in the clear.
Right, yeah, don't discount those symptoms if you're a younger person or you recognize those in a younger person. Strokes can happen at all age, from infant to elderly, but we see in this area that the majority of our stroke patients are in the 46 to 65 age demographic. Those are young people that are still working, that maybe they've emptied their nest and they want to retire and enjoy life as empty nesters. So yeah, be aware. Just be aware of those symptoms.
What did you say, 45 to 65?
Yes.
Yeah, 46 to 65, young people.
Yeah.
They get younger every day as we get older.
Right, and so that's why it is important too that we take care of our bodies and we do those things to prevent, because it will catch up with us eventually. Yeah. So as we are in month here, we're raising that awareness. What do we want to make sure that people they go and see their doctors on a pretty regular basis?
Yeah.
And just to keep on top of those numbers and things like that.
Yeah,
too.
it's very important to do the annual check because many of these risk factors are silent. You might not realize you have high blood pressure. You might not realize your glucose is high. And with time, the damage can accumulate. So it's easier to recognize it sooner because it's easier to prevent than try to correct it once the damage is done or the vessels are narrowed. Or there's the undiagnosed atrial fibrillation where you have that abnormal heart rhythm. Recognizing it and being on a blood thinner is very important to prevent that next stroke.
Very good. So just to be on top of our health, folks, right?
Absolutely.
Yeah. Thanks so much for being here today.
Thank you.
Thank you.
Yeah, absolutely.